There's a new kind of technology lighting up certain kinds of cancers at Munson Medical Center. It's saving lives, shortening surgeries, and lessening complications for some patients. Michelle Dunaway explains in today's MedWatch report.
Let's turn around this way. The animals have just always spoken to me, and I always wanted to be in their care. So this is absolutely the right choice for me professional-wise.
Patty Tuck spends her days treating patients of the four-legged variety, but it wasn't long ago she was the one seeking treatment. Her doctor found a tumor on her uterus.
And we didn't really have the diagnosis until after I'd had my hysterectomy and they had the tissue. And it was uterine cancer, which is normally confined to the uterus, and in my case it wasn't. It had escaped and gotten into the lymph nodes, so I had stage 3 uterine cancer.
Patty did what she could to keep her life and career on track, but toward the end of chemo, she had to take a step back.
And that was a really tough day for me. That was really tough because that was so much a part of my psyche of winning. But our staff here is wonderful, and even when I couldn't come into work, I would come into work because the camaraderie and the joking around, this is really a family kind of setting here, so I needed that.
And while Patty had her support system, her surgeon, Dr. David Michelin, had his own assistant, the Da Vinci robot. He does nearly 200 robotic procedures a year on patients with endometrial or cervical cancers.
The Da Vinci technology is a vast advancement when compared to typical laparoscopy. The instruments have what we call wrist and actually fingers on them, so they really mimic an open procedure.
The Da Vinci itself has been around since about 2005, but Munson Medical Center recently upgraded to the newest model with special capabilities to help doctors find sentinel nodes.
There's lymph nodes scattered throughout the body, but a sentinel lymph node is thought to be the first drainage point from the organ. So in our case, the uterus or cervix, the sentinel node would be the first drainage point from that organ.
Dr. Michelin injects a special dye into the cervix.
With the new robot, we're able to switch the background to the near infrared spectrum. And so the background is either gray or black, but the lymph node lights up a neon green. And you don't need to be a physician to see that's the sentinel lymph node.
In the past, doctors played more of a guessing game, taking up to 30 lymph nodes out of a patient.
We've become more selective and more sensitive in terms of what we do. We can select the one positive lymph node on each side and then along the aorta, and like I said, perhaps take 3 lymph nodes as opposed to 30.
That means shorter surgeries, fewer complications, and less risk overall.
It really has been a game changer for us.
What do you think? Rainbow? Oh boy, maybe.
And now, almost 5 years cancer-free, a life changer for Patty.
Thanks to Dr. Michelin and a whole lot of talented people and a whole lot of helpful friends, I have yet another spring. I get to watch the bluebirds and the tree swallows fight over birdhouses in my backyard, I get to watch the flowers coming up in the woods, and I get another year with my family. Yep, that's pretty wonderful.
For MedWatch, I'm Michelle Dunaway.